Hi, Michelle Crew here from Physio Professionals. This week's video is regarding shoulders. Shoulders is a huge area that we look after, and a lot of patients will describe pain radiating down their arm, at the tip of the shoulder, or even at the back of their shoulder. A lot of people will describe pain with disturbed sleep, whether they're sleeping on their shoulder or reaching across their body, pain with trying to get a shirt on and off, reaching behind their back, or trying to get a belt or a wallet in their back pocket. Majority of people can have shoulder problems from a trauma, so whether it's a fall or just from repetitive use. So some people can have this gradual build-up of shoulder pain to the point that now it's really disturbing their normal day-to-day living. The biggest thing at Physio Professionals is what we do is a full assessment and get a proper diagnosis. With a proper diagnosis, then we can formulate a proper treatment plan to get you back on track. The biggest thing with the shoulder joint, it's very complex. This humerus head goes up and it's almost a golf ball at the top, and it sits on a little tee. What holds that golf ball on a little tee is what known as 4 rotator cuff tendons. Now these 4 tendons work as a team to stop the golf ball falling off the tee. Majority of patients can injure one or more of these tendons. The most commonly one torn is your supraspinatus tendon. The other thing that a lot of people will have is what's called shoulder bursitis, and that's inflammation of the bursa, which is at the tip of the shoulder. The most common thing that patients come in with is they've had a guided injection. It's given them some short-term relief, but their pain is ongoing. The problem with the injection, it doesn't actually address the true problem. So it's like taking a Panadol or an aspirin and just putting a Band-Aid on the problem. Once that eases off, then the problem is still there. So what we encourage people to do is have a proper assessment, diagnosis, and a step-by-step treatment plan. Big things we need to address is the rotator cuff strength. So some people would have heard of the rotator cuff and they would have gone to the gym and done some strengthening exercises. Unfortunately, some of these gym-based exercises are just dealing with the more external muscles, such as your deltoid, your bicep, triceps, your upper trapezius, and it hasn't dealt with the deeper ones. So the biggest thing is make sure you get a proper diagnosis, step-by-step treatment plan, and we get you back on the road to recovery. 70% of patients do get better with just conservative treatment, and what we try to do is avoid surgery. So if this sounds like you or a loved one you live with, please give us a call today.